Hi, I'm DrFranchesca. I'm one of the family medicine physicians here at Mineola. I have been here for a little over 2 years. I was asked to discuss well woman exams today. I know it's our favorite visit, but I have good news because guidelines have changed over the years and it is no longer recommended that we have a pap smear every year. Women should have their first well woman exam at the age of 21. This first well woman exam includes a pap smear, which is the test that we have to screen for cervical cancer. We used to recommend that you have your first pap smear once you are sexually active. However, that is no longer the recommendation. So regardless of the initiation of sexual activity, whatever age, you have your first pap smear at the age of 21 years. From the age of 21 to 29, it is recommended that you have a pap smear every 3 years. From 30 and above, it's recommended to have a pap smear with HPV testing every 5 years. HPV testing identifies high-risk HPV strains that are associated with cervical cancer. This test is not an additional swab. It can just be added on with the pap smear. In addition, it used to be recommended that we had a pelvic exam every year, but this guideline changed a few years ago as well, and so it's no longer recommended to have a pelvic exam done every year unless you have symptoms or concerns. Now, just because we no longer have to have a pap smear or pelvic exam every year does not mean that you don't need a well woman exam every year. It is still recommended that you have a well woman visit every year, and the reason for that is to discuss the other preventative screenings that other providers have discussed here tonight, such as breast cancer screening, colonoscopies, skin cancer, and DEXA scans or bone density scans. So if you have not had your well woman exam this year, I look forward to seeing you soon.